Junior doctors in the UK have begun a 4-day walkout. They're demanding a 35% pay raise. The UK's National Health Service says England, Wales, and Northern Ireland could see up to 350,000 appointments and operations canceled as a result of the strike. CBS News foreign correspondent Ramy Inocencio is following this from London. Ramy, good morning. Kind of walk us through this. What is a junior doctor and what are they asking for?
Hey there, Omar. Yeah, the term junior doctor is something foreign for American viewers, but it describes a physician who can treat patients, but only under the supervision of a more senior doctor until they get several more years of experience. Now, these can be people often who are in their 20s, so that would put them in their 30s once they can actually be a senior doctor. As for this protest, it basically is over pay. It always has been in the past year. So many protests over pay. Doctors holding up picket signs, as you can see there. £14 an hour is not a fair wage. In U.S. bucks, that's $17, a little bit more than that. Some claim they have to borrow money from family to make ends meet. Others say that they go into this profession already in debt. Some even say that a coffee barista can make more money versus a first-year junior doctor. But the British Medical Association, which is the union behind this, claims that real wages have actually fallen more than 25% in the past 15 years. That takes into account inflation too. And last month they demanded a 35% pay rise, as you said. They're calling this pay restoration, but Britain's health secretary here says that is just unreasonable. And he's saying that the strikes that have started already need to be called off before any talks can start.
Well, let's talk about what kind of impact this could have. I mean, healthcare workers are in demand across the world, but what are we likely to see here when it comes to services?
Yeah, this is pretty massive. Nearly 48,000 junior doctors could walk out at any time during this week, and that accounts for about 45% of all the doctors on staff in the National Health Service. People have actually been told to not engage in risky behavior. Wow. That could be anything from driving a car safely to not doing certain kinds of sports that could send them to the hospital. But we've heard this before, which is also anxiety-inducing, I would say. This is the second time in 2 months junior doctors have already gone on strike. Last month, a 3-day strike forced the cancellation of 175,000 appointments. This 4-day strike could see 250,000 operations canceled. Some hospitals say that half of their treatments could be affected. And the timing of this couldn't be much worse either. It's coming right after the Easter holiday, right? Here in the UK, Easter Monday was a public holiday. Now, this week we're in now is when more doctors take time off and actually when more people go in for treatment. The medical director of the NHS says that this actually could be the most disruptive industrial action in NHS history.
And you mentioned this is the second time junior doctors have taken a strike action this year. Yeah. What does this do to the current state of Britain's healthcare system?
Oh, wow. The NHS is marking its 75th anniversary this year, and there has been a lot of criticism of the UK's current Conservative government. It's been in power since 2010, and many critics of the government say that the basic problem is that the Tories, as they're also known, don't believe in the NHS, that they're underinvesting, making these jobs less rewarding, making wait times longer, so that the public potentially will turn to the private sector like we have in the United States. Now, to that point, the NHS itself says waiting lists for treatment have hit a record high of more than 7 million people back in January. And I've got some numbers for you as well here. Waiting times for cancer patients are the worst on record. More than 600,000 people waited more than 2 weeks to see a specialist. Oof. That's 10 times more than a decade ago. Also, nearly 400,000 people have been waiting for more than a year for treatments, including non-emergency things like herniated discs and hip replacements. And obviously, this is a lot of discomfort and pain to endure. And when you're thinking about something over the course of a year, that's a lot of time to wait. The government, though, for its part, says it is trying to make the NHS run leaner and more efficiently.
Well, and you mentioned it, when you're in pain, the one thing you don't have is time to wait. Something we'll be watching. Ramy, thank you very much.
You bet.